Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning is your health. The City of Milwaukee Health Department's 2015-16 health assessment showed that Milwaukee is one of the nation's most impoverished cities and has a poverty rate of 29%. The city also has a higher than state average of infant mortality, STDs, violence, and cancer. My first guest is Dr. Tito Izard, who is the president and CEO for Milwaukee Health Services Incorporated, an independent, not-for-profit, federally qualified health center. And we're also being joined by well-known comedian D-Rock, who will be participating in Milwaukee Health Services Incorporated's Laughter for the Soul event coming up on September 18th. Good morning, gentlemen.
Good morning.
Good morning.
Pleasure to have you here.
Thanks for having us.
And Dr. Izard, as I stated in the open, Milwaukee has some of the highest health disparities in the state, and Milwaukee Health Services Incorporated obviously is committed to removing barriers and improving health outcomes to actually tackle that. What are some of those barriers?
Unfortunately for African Americans, which our organization predominantly serves, we have to deal with some of the, as you mentioned, the health disparities that exist, whether it's cardiovascular disease, diabetes. Pretty much if you list the top 10 causes of death or mortality, that African Americans rise to the top of that list, unfortunately.
Wow. And do we really understand why that is?
We understand it. We understand a lot about it, but it's really a complex issue. It's not just one thing that can be fixed. It really involves a lot of different components that affects that mortality. A lot of it has to do with, we refer to as social determinant of health issues related to poverty and economics and education and health literacy. That's people's understanding of the healthcare system and all the things that goes along with it, in addition to things like lifestyle related. So whether we smoke cigarettes, our nutrition that we're putting in our body, the amount of physical activity we get. So it ends up being a number of different things that all contributes together. And then at the historical context of African Americans and the issues that we've had to face as a people kind of confounds on top of that to really negatively impact our health and wellness. And that's why it's so important that we understand what those things are so that we can know what to do about it.
Yeah, very interesting. And MHSI has two locations in Milwaukee, the MLK Heritage Health Center on King Drive, and then of course the Isaac Cogg's Heritage Health Center on Silver Spring Drive. You guys are actually celebrating 27 years of serving the community. What impact would you say you've had on being able to be in those locations and offer services?
Yeah, we're very proud of the 27 years that we've been in the community. Milwaukee Health Services, as you mentioned, as an independent not-for-profit organization, its emphasis and focus is on serving the underserved community. And what does that mean? That refers to people who are either underinsured or they have no insurance at all. And we try to make sure that despite what your insurance situation, you have access to great physicians and other healthcare providers to make sure that you can achieve your health goals.
Yeah, and real quick, what are some of the services that you offer to individuals on a daily basis for those people watching at home?
Primarily what we refer to as primary care, which is family medicine, internal medicine, pediatrics, women's health, in addition to other services such as dental, where we have dentists as well as hygienists to get your teeth clean and make sure you're doing great oral health prevention. We have podiatry on site. We have pharmacy on site so people can get their medications at a discount. Understanding affordability is a big issue, as well as HIV services and mental health services, counseling, therapy. So we have a wide variety.
Pretty much cover it all.
Yeah, exactly.
Absolutely. And D-Rock, not forget about you over there. You're joining us today to help promote a major event that is being presented by Milwaukee Health Services Incorporated. It's coming up on September 18th with internationally known superstar Cedric the Entertainer.
Yes,
we'll talk more about the event in just a little bit, but first tell us why it's so important for you to be a part of an event that's set up to not only make people laugh, but also to spread awareness when it comes to people's health.
Well, first of all, being a comedian, a lot of people take you as a joke, 9 times out of 10, but when it's something that hits home like health, like myself, dealing with my father and, dealing with health issues that we have as men, we don't go to the doctor, we don't take care of ourselves. And a lot of people take you as a joke, like, whatever, but it's a real serious situation that we don't go to the doctor. And we need to, like, get out here and understand that we do have to take care of ourselves just like everybody else.
Absolutely. So you mentioned your father. What are some of the issues that your dad?
Well, my dad never went to the doctor. And
That's
I just
starting
remember
a lot
that.
of men.
Yeah, you just don't. We're okay. We'll take our car to the shop before we go to the doctor.
That's true.
And he was just always, the healthy guy. And then all of a sudden, his sight started going bad. And then he started going to the doctor a little bit more. And then something happened to his foot. I think he had to get his gangrene or something, and then they found out it was diabetes, and then his sugar was always up. So next thing you know, he's poking himself all the time, and I'm asking questions, but being a man, you don't talk that type of things to your son or your family. So it ended up he had one surgery, he had to get his leg amputated, and we dealt with that, the amputation, and dealing with him not being healthy and me being on the road sometimes. I had to really take a part out and say, well, what's more important, family or home? And then it became family. And he had a minor surgery to close up a wound, and he ended up almost bleeding to death. And then they said it was an accidental, whatever the situation was, but it was complications from having that, the amputation and diabetes. And he had a form of cancer. I'm not gonna really touch on that because Mom and Dad really had that like under control. We don't talk about it in the household.
And that's the thing.
And
People
it hurts,
don't talk about their health. People just kind of want to take care of it.
Yep.
Or say the sugar's a little high today
And it's all right,
keep
and
it
keep it
moving.
going. Right,
Yeah,
right. But every
we
Sunday,
do need to communicate about all of these things because it's important. And when somebody else deals with ailments and suffers from them, ultimately die from them, it teaches us about what we need to do, and we can also spread the word to help others, right?
And we don't take a time, like you said, the stuff we eat. Right. We don't take time out like Soul Food Sunday, and we eat all of that we've been eating all our whole lives, and it's not healthy.
Yeah, you guys had Cedric the Entertainer here last fall, I believe, and last summer. I can't remember
about a year ago.
Okay, yeah. And he and I were laughing during a radio interview because we were talking about people who have diabetes and high blood pressure and all these things, and they'll say, "Oh yeah, I'm gonna fix these sugar-free hog mugs."
Right?
Yeah, it's like
gonna eat it, right?
They're low salt, and it's just kind of like we laugh, but it's the truth.
It's the truth,
and sometimes you have to tap people on the shoulder and say, "You're not supposed to be eating that." That really did happen. My aunt had said she was cooking for her my uncle, and she said, "Oh, these are lean. These are lean hog mugs."
Really?
Oh, okay. I never heard of such, but
and that's what we're trying to do. We're trying to bring a little humor, a little comedy to a very serious topic. As D-Rock is mentioning, so many people take things so seriously that it's a taboo. We don't like to talk about it, but it's real important for us to be able to laugh and make fun of ourselves at least a little bit, enough to make us feel comfortable to ask those questions. So because health and wellness is not just about us, it's really about the whole family. It impacts the whole family,
sure does.
As well as that health history of when you go to the doctor in the future and be able to say, my family member had XYZ condition, that may lead that healthcare provider to do certain types of testing or to make sure that you are not at risk of that same condition.
Wow, it all makes so much sense. And he's talking about his dad having those complications from diabetes, which we know can lead to kidney disease and amputations, as he was saying. So screenings and early detection is so very important. So you can't wait till you feel bad or something's wrong. You have to really go to the doctor on a regular basis, meaning at least once a year, and have that doctor kind of have an understanding of where you are health-wise so that when something is wrong, they recognize it.
Absolutely, and I kind of describe it as if you're standing on a cliff, if you're blindfolded, you don't know how many steps away from the edge you are. And the job of the healthcare provider team is to help you identify where you are on that cliff so that if you stop and you don't move forward, you may be next to the edge, but if you stay still, you're not in any more danger. But unfortunately, we're blindfolded and we keep doing these lifestyle things, whether it's nutrition or behaviors, that moves us closer to the edge. And unfortunately, the doctors can only tell you sometimes after you fell off the cliff, and then it's Humpty Dumpty, put you back together again.
Yeah.
So what we like to do is to focus on the health prevention piece so that we can let you know what your risk factors are and hopefully stop you from getting close to that edge.
Yeah, and earlier this year, MHSI teamed up with Fight Colorectal Cancer.
Absolutely.
And I learned so much because my father was diagnosed with colon cancer when it was in stage 3. He was also like a picture of health, played tennis every day, rode his bike every day, and then all of a sudden, you know, it was like he had stomach aches here and there, but he kind of just waited till it subsided, and then you're diagnosed at stage 3. And what I've learned from even just him having it and you guys having this type of program to educate the community is that, one, colon cancer is one of very few cancers that you can prevent.
Absolutely.
And also, you just learn that you have to follow those guidelines. When they say get screened at 50 or get this or that done by a certain age, that's what you should do, unless, of course, there's a family history suggesting you do it earlier.
Absolutely, and I always like to make sure when I'm talking to one person or an audience of people, let them know, most people don't realize of all the cancers that exist, you know, any cell of your body can develop cancers, but of all the existing cancers, there's 3 cancers in men and 3 cancers in women that causes over half of all the cancers. So in men, if we look at lung cancer, colon cancer, and prostate cancer, that's over 50% of them. In women, same thing, lung cancer, colon cancer, and breast cancer. So in certain cases like colon cancer, if someone is getting screened starting at age 50 or 10 years earlier than your family member who had it, then that person could potentially prevent themselves from getting cancer. Lung cancer, don't smoke. You significantly reduce your chance of getting cancer. And then whether it's, you know, mammograms, having that conversation, whether to get a mammogram, those conversations with your doctor, or in men prostate, whether it's indicated for you to get the prostate test. Some of those things may be controversial, but that's why it's important to talk to your healthcare provider about what your risk factors are.
And before we run out of time, I've been teasing this upcoming event for a minute now, and it's called Laughter for the Soul, Chuckles for Your Health. Again, it's happening September 18th at MATC's Cooley Auditorium with one of the funniest guys out there, Cedric the Entertainer. And this is something that people can look forward to because not only, like I said earlier, will it be a situation where you're laughing, but you're also walking away learning something as well, right?
Absolutely. This is a fundraiser for Milwaukee Health Services, and we're very excited to be at a point in this community where we can continue to try to serve more people. Since the 27 years that we've been open, we've had almost 1.5 million visits. So people come through, receive some type of health service, and we love to continue to do that for many more years. So with our sponsors, such as American Cancer Society and Millennium Healthcare and Anthem and Aurora and Tri-City Bank, and so many different organizations and individuals have contributed to making sure that this event turns out well, and that in the end we're able to serve more people in this community.
Yeah, and that's what it's all about. So just a few of the details. It will be hosted by several different people, including funny lady comedian Kelly Kells. You've got Cassandra McShepard, and then I am so blessed and happy to be a part of this as well. Comedy from our man D-Rock, who has already let it be known that he understands what it's like to have a family member deal with health issues, but you can take that and probably make some people think for a minute and kind of chuckle as well.
Most definitely.
And some other great local.
Oh yeah, we got the Jester on there. We have Rob Haswell, who's a comedian.
A comedian and a meteorologist. That's going to be really interesting.
He's hilarious. We're really going to have some fun. And I need to talk to you too about the prostate thing too. I got to find a doctor with small hands. But anyway. 'Cause that time
Always
is coming
joking.
up.
There's also comedian Carl Strong, and is it Drew Quills?
Drew Quills, yeah.
Okay, and music from Christopher's Project featuring Jackie Caldwell and DJ Cheerios. So it's going to be a lot of fun.
Yeah.
Ticket information, Dr. Izard, where can they go for the details?
The easiest is just going to our website, mhsi.org. And right there on Milwaukee Health Services website, you can scroll down and find information regarding the event and purchase your tickets right from there. For others, if you like to call, you're welcome to call either Milwaukee Health Services site and ask to speak with Pam Clark. And Pam can set you up to help you, assist you in the process of purchasing tickets.
Okay.
Also what we're doing is, because this is a community event and we don't want anyone to be left behind, there are a number of organizations and individuals who either can't attend themselves, that they're gifting their tickets to others. So we're encouraging those in this community who really want to support the health center and participate to purchase tickets, 1, 2, 5, 10, and actually gift your tickets to a family or friend or someone you know really needs that laughter for the soul.
Yeah.
And otherwise, gift them to the organization, and we will ensure that members in this community who would like to attend are able to attend.
Sounds good. And those tickets are from $20 to $80. The $80 tickets include a brunch and a meet and greet and a lot of great things. Like you said, for all the details, they can go to your website at mhsi.org. I want to thank you both for stopping by. So important to be able to talk about health, but also let everybody know about the fun and exciting things happening in our city as well.
Most definitely.
Thank you.
Thank you so much.
Dr. Tito Izard is the president and CEO of Milwaukee Health Services Incorporated. Again, you can log on to mhsi.org to get more information on anything that we've discussed today. And comedian D-Rock, he'll be one of the many talented performers at the Laughter for the Soul, Chuckles for Your Health, starring movie star, game show host, and one of the original kings of comedy, Cedric the Entertainer. Follow D-Rock, by the way, on social media at KASOYF, which stands for Keep a Smile on Your Face. When we return to Our Issues Milwaukee, we'll continue our conversation about health. We'll be joined by Jennifer Washington McMurray, who is the Health Systems Manager for the American Cancer Society. We'll do that when we return to Our Issues Milwaukee.